I'm Arnold Levinson. I'm an associate professor in the Colorado School of Public Health and the member of the University of Colorado Cancer Center. In 1965, the Surgeon General issued a report for the first time that said that smoking causes lung cancer and heart disease in men, and we think it probably does in women. And from that day forward, with a few minor exceptions, the trend in cigarette smoking in the United States has been tumbling. We went from that nearly 50% prevalence in 1965 down to about 20 to 25% prevalence in the year 2000. Now, in the last 15 years, we've started to see this slow down. We've hit a major speed bump, you might say, in that the rate of decline of smoking has really leveled out. And the really unfortunate news in my book is that most of the people who continue to smoke now are people with lower socioeconomic status. Whether you measure lower SES by education, by income, by whether a person has health insurance, by their job, any way you slice it, what you find is that well over half of the remaining smokers in the United States have lower SES.
Now, we think this phenomenon reflects a lot of things, including that better educated people are more likely to attend to the health messages about smoking, that better educated people are less likely to be surrounded by smokers and might be more likely to work in areas where smoking is prohibited, and that better educated people are less likely to have grown up in homes where smoking was allowed. But also better educated people have more opportunities, have richer environments, and there's really good evidence from both animal studies and human studies that enriched environments are associated with less susceptibility to drugs, including nicotine, but not just nicotine, but all sorts of drugs. So better educated people have more opportunities for learning, for recreational opportunities, and they have more what we call alternative reinforcers. They might find other pleasures in life.
The greatest difficulty I think we have in the field of trying to help people quit smoking is understanding how to help folks who, even though we don't like to admit it, get something out of smoking that they consider a positive benefit. Perhaps they feel that life is too difficult, too stressful, whether economically or socially, whether at home or in the workplace. One way or another, a lot of people who get hooked on cigarettes do so in part because they find that it gives them a 30-second relief of a bad mood or a feeling of being stressed out. And we haven't figured out, if life is going to be stressful for you in these ways, how to help you overcome this reliance on cigarettes as a coping mechanism and how to learn to live in life without cigarettes.